Good afternoon, everyone. Thank you for coming in today for the first Read with the Expert series. So hopefully you can all see my slides. It's great to see already 45 people online. And so without ado, let me just dive right into the webinar. So one of the things that you will see that the cases selected in this series are not necessarily everyday cases, but they are things that you might encounter every now and then. So there's this notion of desirable difficulties as well. So it has to be sufficiently challenging for you to actually engage in it, and so that you're not bored of the sort of stuff they were showing you. So case number two, we have a 55-year-old woman with a history of a retroperitoneal tumor and non-specific abdominal symptoms. And we posed the question to you um, that we perform a CT for disease surveillance. And the first thing we asked you was that, what do you think about this tumor in the left retroperitoneum? And we see that this tumor has a biphasic appearance. There is a soft tissue component more laterally, and then there is a medial component that comprises of density that is of fat density, although the fat is not entirely clean, with some stranding within. And we asked the question, what is the most likely diagnosis of this left retroperitoneal tumor? It is perhaps a little bit unfair to be asking the audience in the liver sort of focus webinar what this might be, but this is a general knowledge question, I think. And we gave the choices of gastrointestinal stroma tumor, paraganglioma, liposarcoma, leiomyosarcoma, and fibrohistiosarcoma. And we asked the question, and the responses were, you can see that the majority said liposarcoma, which is absolutely the right answer, because none of the other lesions are expected to contain any significant fat at all. So this is the right answer. The tumor was indeed a liposarcoma. Then we also showed you the entire rest of the CT, and those that have reviewed the imaging hopefully would have picked up some foci of sclerosis within the bones. And then we wanted you to focus on the liver, where we see that in these selected imaging through the liver, we have multiple low density lesions, most of them less than a centimeter or less than 5 millimeter in size. They are not well demarcated. If anything, they're quite poorly demarcated, although definitely low density. There's no association with any enlarged uh, lymph nodes in the upper abdomen. Neither is there evidence of biliary obstruction. Going further up, I think what you will see within the lungs are these micronodules that are scattered within both lungs. And also the interlobular septae, some of them have these nodular appearances, for example, and here as well. And then another lung section that, again, you can see some beading along the bronchovascular bundle. So we asked the question, what is the most likely cause of the hepatic lesion? Was it liver metastases from left retroperitoneal tumor? Were these liver abscesses? Were they parabiliary cysts? Were they granulomatous disease? Or was it eosinophilic liver infiltration? And this was the distribution of the findings. So most of you thought that it was granulomatous disease. Some of you thought they were parabiliary cysts. Some said eosinophilic infiltration of the liver. And some thought that this could represent metastases from the left liposarcoma in the retroperitoneum. So these lesions, they are really quite small, irregular, multiple. I guess it could be metastases, but with the systemic finding that we're seeing, particularly in the lung and those sclerotic lesions, they make it a little bit, well, they make it less likely. Metastases from sarcomas are typically lytic, for example. Liver abscess, the patient often will have different symptoms like fever and being generally unwell. Parabiliary cysts are typically more well defined. That leaves us granulomatous disease and eosinophilic liver infiltration. And eosinophilic liver infiltration is an interesting entity. For those interested about it, there are two articles that you can refer to. And they are fairly uncommon. They can present as focal or segmental lesions, usually subcapsular or along the portal branches. Again, poorly marginated borders. But the lung changes associated are usually airspace rather than nodular changes that we see here. And so indeed, this case is actually one of sarcoid infiltration of the liver or granulomatous disease. And sarcoidosis of the liver can take two major forms, either as you see in our example, small nodules of 1 to 3 millimeter to sometimes several centimeters that are hypo and dense and non-enhancing, or they can be therefore confused with miliary metastases, or much more large and confluent, either solitary or multiple lesions in low density, like here, without any significant biliary dilatation. So sarcoid involvement of the liver is relatively common, especially on autopsy series, but it is reported that as much as up to about 70 to 80% of patients with sarcoid can have liver involvement, although they may not present with focal lesions. So they may have deranged liver function tests, they may have enlargement of the liver, for example, but focal liver lesions, as you see here, are still relatively uncommon.